The birthing center closure is creating a lot of stress for expectant mother Caitlin Hudson at a time when she says she's supposed to be excited to set up a new crib. She says she sympathizes with other moms who don't have the time or resources like she does to find a new place to give birth.
I also have a very, very close relationship with my OB, my doctor, and that is probably the most devastating, is having to completely start over with that care somewhere else.
She, along with her siblings and her first child, were born at Dearborn. Hudson could have had her child there if her delivery date was before December 31st. That's when St. Elizabeth's Department of Obstetrics and Gynecology expects the center to close.
We need skilled labor and delivery nurses. We need skilled physicians and midwives to be able to provide those services. I think if we have those staff available to do that, then we'll continue until the end of the year.
It's that number of skilled healthcare workers Dr. Loftus-Smith says is hard to justify keeping at a hospital with a low delivery rate.
We have in-house pediatric teams, in-house anesthesia teams, in-house laborists who are OB-GYNs and midwives who are always in the hospital if an emergency would arise.
St. Elizabeth tried to recruit additional providers, but she says it's not successful enough to keep the center open. Employees at Dearborn can transfer to a different department within the hospital or go to Edgewood. One physician isn't sure what she'll do since she'd be driving an hour and a half one way, but she also doesn't want to abandon her patients.
Across the United States in general, we're getting all of these maternity healthcare deserts where there are huge areas of no prenatal care.
You can always find our stories here on YouTube, but go ahead and tap subscribe. That way you're always in the know.